JACIE is the joint accreditation committee of the ISCT, that's the International Society for Cellular Therapy, and the EBMT. It was formed in the late 90s based on a model which was already up and running in the United States of standards and inspection-based accreditation. It's essentially built around quality management in the clinical setting, but also in cell collection and cell processing as well.
I'm a physician and I'm involved in both the clinical and the lab part. So we use cells like a drug. The quality of the graft, so the quality of the stem cells and the manipulation of the stem cells we infuse in the patient are equally important as a good clinical practice in drug administration. And together the quality system implementation is quite important because it's a sort of tool to keep all these components together.
Since 2000, JACIE has received over 380 applications for accreditation. We're in 26 countries, most of them in Europe, but also South Africa, Singapore, and the Middle East as well, Saudi Arabia, Israel and Lebanon. Many of those centres have also gone through one or even two cycles of re-accreditation since they first applied to JACIE as well.
It's a high-risk specialty, so it's vital that the systems are in place to minimise risks and improve safety, improve outcomes in patients that are often having treatment at very critical points in their pathway.
The standards are developed jointly with FACT, who are based in the United States, and therefore they're truly global standards. They have a relatively short lifespan as well. It's a 3-year cycle, so that allows us to respond relatively quickly to advances in the field or advances in practice as well, and to reflect reality in transplant on a reasonably fast-changing basis.
Some say it's as good as some of the major scientific advances or drug-based advances in oncology, the improvement that's been achieved with JACIE, and that's really just rolling out quality management processes, having lots of checks and balances, and correcting practice as we go along, and having those systems in place can improve patient outcomes.
Taking what we've done in Europe and in the United States and other parts of the world and making that model accessible to transplant centres in countries which face bigger challenges in terms of resources, in terms of staffing, in terms of indeed culture around quality management. With FACT, we're developing a stepped model which will allow centres in regions such as South America or perhaps in Asia or even in Africa the possibility to access the accreditation model in stages rather than having to face the entire process in one go. They will be able to take it in steps. And we hope that this would also increase access to a medical technology or a treatment which often is the only treatment available for many indications or conditions.
The quality system has been perceived initially as something like bureaucratic, but as soon as you use the accreditation process as an everyday tool in your professional activity, you realize that the quality system is a tool to improve your activity and the safety of patients.